Good morning, everybody. So, as my partner and I previously claimed, we are advocating that women should only be allowed to an abortion up until the first trimester of pregnancy. And like the negative side stated, they were emphasizing that it may be safer to have an abortion during any trimester. And according to the woman's health care physician, they stated that abortion-related mortality increases with each week of gestation with a rate of 0.1 per 100,000 procedures at 8 weeks of gestation or less, and 8.9 per 100,000 procedures at 21 weeks of gestation or greater. This ultimately means that abortion later in pregnancy can lead to a woman's death. And then the methods used for late-term abortion can get much more complicated and dangerous. According to the pregnanteve.com, abortions are one of the safest procedures during the first trimester. In the second trimester, the risk of death from childbirth is 11 times more than that from abortion. Medical abortion using abortion pill can be done during the first trimester and up to first 10 weeks. Surgical abortions can also be done during the first and second trimester. Abortion is done up to 16 weeks after the last period. Dilation and evacuation methods are done after 16 weeks. Induction is done after 16 weeks of pregnancy. According to the NCBI, which talks about abortion complications, the frequency and severity of abortion complications depends on gestational age at the time of abortion and the method of abortion, which ultimately means that the later a decision is taken in terms of abortion, the more complicated it can be. According to the late-term abortions, it can lead to medical risks. According to the woman's healthcare physicians, complications associated with both dilation and evacuation and medical abortion include hemorrhage, cervical laceration, retained products of conception and infection. Uterine perforation can occur during the dilation and evacuation method, whereas uterine rupture can occur with medical abortion. Late-term abortions can also have medical complications. According to the AmericanPregnancy.org, approximately 1 out of every 50 late-term abortions, it is important to be aware of the following risks. 1. Heavy or persistent bleeding. 2. Infection or sepsis. 3. Damage to the cervix. 4. Scarring of the uterine lining. 5. Perforation of the uterus. 6. Damage to other organs. And 7. Possibly death. And the negative side also claimed that they had more access, and according to all trimesters in abortion have more access, but it is rather more expensive. According to the prochoice.org, in addition, as the pregnancy advances, abortions have a higher risk of complications, require special skill from the physician, increased nursing care, and more medications. Therefore, they are more expensive. And the longer that the decision is made for an abortion, the more expensive it will be. This is an example. According to Denver, Colorado, based on the abortion prices, for consultation and ultrasound, it is $150. A medication abortion from 6 weeks to 9 weeks is $450. A surgical abortion from 6 weeks to 10 weeks and 6 days is $350. But you have an option of having oral sedation, which is $375, and an intravenous sedation, which is $475. And then a surgical abortion from 11 weeks to 12 weeks and 6 days is $430. But with intravenous sedation, it is $555. A surgical abortion from 13 weeks to 14 days and 6 days is $645. A surgical abortion from 15 weeks to 16 weeks and 6 days is $860. And then a surgical abortion from 17 weeks to 17 weeks and 6 days is $1,720. And then a surgical abortion from 18 weeks to 22 weeks is $2,150. So late-term abortions can lead to complications that can be costlier after the abortion has taken place. So according to medicalnewstoday.com, women who experience any symptoms of complications may need an immediate appointment with a doctor. Although it is not common, some abortion complications may require a trip to the emergency room. So if you decide later in pregnancy to take an abortion, you're going to have to sum up all the prices to have an abortion and additional costs if you have a complication after you have the abortion. And then and we have to also keep in mind that the fetus feels the pain that it undergoes by the second trimester of pregnancy. According to LoserInstitute.org, sensory receptors for pain develop first around the mouth at 7 weeks and are present throughout the skin and skin surfaces by 20 weeks. Connections between the spinal cord and the thalamus are relatively complete by 20 weeks. According to women's healthcare physicians, the complications associated with both dilation and exhalation become more costlier and lead to a higher medical risk.